Hello everyone, welcome to my channel. Hope you are doing well. So today in this video we are discussing a question related to hepatic encephalopathy. In the previous video we have discussed about end-stage liver disease. And moreover that this is a select all that apply question. It's been a long time we haven't discussed any select all that apply question, so I thought we'll see one question. Okay. During morning rounds, the nurse notices that a client admitted 3 days ago with hepatic encephalopathy is sleepy and confused. The client is scheduled for discharge later today. Which interventions are appropriate for the nurse to implement? Select on that apply. Okay, so in the question, just we will repeat some of the keywords in the question that the client is admitted with the hepatic encephalopathy 3 days ago. Now the client is sleepy and confused. Actually, the client was okay, so they already scheduled for the discharge, but at present the client is sleepy and confused. So something went wrong. So what are the interventions will be appropriate or should be take at this time? We'll see the options. Option 1, assess the client's hand movements with the arms extended. Option 2, compare current mental status findings with those from previous shifts. Option 3, contact the healthcare provider to request a blood draw for ammonia level. Option 4, encourage the client to ambulate in the hallway. Option 5, hold the client's morning dose of lactulose. Okay. So we'll just brief an idea about hepatic encephalopathy. Hepatic encephalopathy, it is a complication of end-stage liver disease, and which is mainly results from the detoxification of ammonia in the blood or cause an excess ammonia in the blood. So what will happen? Client may end up with the hepatic encephalopathy and they will exhibit some of the symptoms of that. What are some of the clinical manifestation of this hepatic encephalopathy? Clients may have like asthesics. Asthesics like what we can say the flapping tremor when the hands are facing forward, and they may have mental status changes like confusion and a slurred speech. Client is always lethargic, and if these symptoms are noticed and the client is already diagnosed with hepatic encephalopathy, if the client is not treated, what will happen? It may lead to coma, and sometimes it leads to death also. So that's why we have to frequently monitor the client for the symptoms, lab values, and how they are cope up with the mental status compared to the previous their situations. So this scenario, the client was admitted with the same condition and was receive all kind of treatment, scheduled for discharge also. But at present, the time of discharge or just prior to the time of discharge, we notice that the client is confused and sleepy. So which means that I think the hepatic encephalopathy is getting worse and again. So what do we have to do? We have to start the interventions again. We have to repeat the blood ammonia values, and we have to check the client's hand movements or is there any asterisk, and we have to look for other mental status changes. This we have to be compared with the previous days or previous shifts. Then we will get an idea, okay, whether it is improving or it's worsening. So if the encephalopathy continues to worsen, medical treatment is very necessary and it should be start immediately. So what are the common medical treatment if this encephalopathy worsens? The primary treatment for this one is that lactulose. We have to give lactulose enema or give lactulose like 2 or 3 times a day. And what will happen? It will help the client to pass the excess ammonia will be going out of the body through bowels. Like it could be like a soft or loose stools. So we have an option in this question that the last one, hold the lactulose. No, we can't. We have to give the lactulose. Then only the excess ammonia will go out of the body. Then the another one is that antibiotics treatment, rifaximin. So that the doctors will be prescribed as per the dose and the client situations. So at this scenario, The first thing what we should understand that we are not able to proceed the discharge process. We should hold the discharge. We should hold until the client gets stable. That is one point. And we said that the option one, assess the client's hand movements with the arm extended. Why we have to assess? Yes, we have to assess because this is a sign whether it is there or not. Asterisk. When we are assessing, we'll came to know asterisk is improved or it's getting worse. If it's getting worse, means okay, the condition is getting worse and we have to hold the discharge. So the option one is the correct one. Option two, compare the current mental status findings with those from previous years. That is also correct. Then the option 3, contact the healthcare provider to request a blood draw for ammonia level. Okay, we wanted to assess whether the ammonia level is increased or decreased, how it was from the previous sheets. So option 1, 2, 3, these are the correct and appropriate interventions to implement the current situation and to identify the further problems. Option 4, encourage the client to ambulate in the hallway. No, that's not possible. We already said that the client is sleepy and confused. So if you are encouraging or helping the client to ambulate, what will happen? There are chances of a risk of falling. So that's not something we can do at this point. So option 4 we have to remove. Then option 5, hold the client's morning dose of lactose. No, we can't hold. If we'll hold, what will happen? Client will not be able to excrete the ammonia through bowels. It's not possible. So answer for this question will be option 1, option 2 and option 3. I hope you understand why we have eliminate option 4 and 5. These are not the appropriate interventions at this point. Okay, so we'll see with another question in the next video. Bye bye.